So this is a tricky case. Yeah. Why is it a tricky case? Because of this view here. Do you see any midline shift here?
Slight midline shift to
Slight.
the left.
I
Yes.
can't assess properly, but I cannot see like that. This is a true midline shift to the left. You have unilaterally blocked out canine, and then you should be seeing a midline shift. So why is that critical now? It's critical for anchorage because when you look at this side now, you would if the midlines are corrected, if the midlines are on, it means that the extra space that you need for that blocked out canine is going to come from where?
Can we distalize?
Yeah, clap hands. Is that Carson?
Yes.
Yeah, Carson is like a biomechanics guy. So it's telling you if the midlines are on and you have a unilateral blocked out canine, your tooth movement now should be directed to distalize the posterior segment in order to create space for that canine, which means that your biomechanics will be totally different. So for some people who would say, if I get a midline shift with a unilateral blocked out canine, I'm in a mess. No, you are not. Because you are just going to put a coil spring now between the fore and the lateral incisor. You are going to get some distalization on the posterior segment, and you're going to get midline shift correction. So this is like a push mechanics, a normal push mechanics that is going to get you a space for the canine. But in this instance now, if the midlines are on, you don't want the midline to be shifted. And this is one thing that most of you is going to be having if you don't control for anchorage, which means that when you put a push coil spring, you should always be targeting the distalization of the posterior segment. And this is one of the cases where I would do a palatal anchorage and I would do a distal jet appliance. So the distal jet appliance in this instance is going to produce you pure distalization of the posterior segment, creating a space for this blocked out canine without touching the anterior teeth. And this is what you should be starting with, Jack. So you start with the appliance first, you distalize, then you bond, yeah, and you both extrude and align this canine in place, yeah. So in order to do this, I do this now in 3D. So what you need, Jack, to do is to get me scans for that patient, and
The
if
scans
possible,
to the
yeah, scans, digital scans for the
CT,
upper, yeah, for the upper and lower
CBCT.
arch, and if possible, yeah, it would be great. It's like the case for V. We have done just because I'm going just to direct the. Have you seen how easy we did place the mini screws to the patient for V?
Yes.
So it will be as easy because we are going to direct the mini screws with the help of the cone beam CT. So you can get a cone beam CT of the upper arch, both digital scans, and we are going to do this distal jet, and you are going to place that. If you get a good camera, a good digital camera by next time, or maybe use Adnan's help to take you good photos, so that you can put that on Instagram now.
Dr.
Yes,
Ahmed,
yes.
I lost you in between, and you said if the midlines are shifted, then you'd use a coil spring.
Yeah.
Is that correct?
Yes, if the midline is shifted, you want both distalization of the posterior segment and the midline shift correction.
Yeah.
Fine?
Yeah.
So you can use push mechanics easily. You can put a coil spring between the fore and the lateral incisor, and you get space easily now because the push coil spring is going to correct the midline and correct the class 2 molar relationship at the same time. Fine?
Yeah.
But now, because the midlines are on, you can't do that. If you put a push coil spring now, what would happen to the midline?
It'll get messed up.
Yeah, it's going to be shifted to the opposite side. Yeah? You don't want this to happen now.
Okay.
So this is when you are going to correct, you get the space for that canine by distalizing only one side.
Okay.
using that distal jet supported on mini screws.
Okay.